Hi, my name is Dr. Chris from Astute. What is HIFU all about? So HIFU basically stands for High Intensity Focused Ultrasound. It addresses one of the main concerns of a lot of patients, which is achieving a lifting effect. There are two main settings that we do. One is to hit 4.5 mm below the skin, and the other setting is to hit 3 mm below the skin. The whole purpose and benefit is to cause controlled damage underneath the skin so that through time and healing, collagen will be produced and thus result in a lifting. Is there any downtime for HIFU? HIFU is one treatment that's non-invasive, something that can be generally accepted by a lot of patients. One of the benefits of doing HIFU is that there's not much downtime. If anything, there's just mild soreness for around 2 to 3 days around that area. Right after the procedure, you might have a little bit of a blush. Otherwise, it's something that's very acceptable, and most people go back without being their friends or family ask them if they've done anything. How long does it usually take to see results? First, with any treatment, individual results vary, that's one. But generally, it takes up to 6 to 9 months to start seeing effects. So how often should you be doing HIFU? Generally, on average, we recommend that they do once every 6 to 12 months. With any treatment, there are limitations as well. So HIFU helps with mild to modest lifting, but it cannot achieve surgical results, such as doing a surgical facelift or whereby the patient with very extremely saggy skin, they require a significant lifting. Patients understand that HIFU is not able to achieve that. But if it's moderate sagging of the skin, they want something that lifts it up, then of course these patients would be good candidates for doing HIFU.